Let's talk about health literacy. Health literacy is a concept that seems simple, but it's actually quite complicated. So first of all, just reflect on your own health literacy. You have a certain set of skills that allows you to be able to understand health information, or maybe it gets in the way of understanding health information. But also you have skills that allow you to use that information in order to make decisions, and hopefully they are good decisions about your health. That's a lot going on there. That's a number of different skills that are all folded into that one statement, and that's why I've underlined some of those key words, because they really do stand on their own. Each one of those underlined words is a certain set of skills. So let's take a moment and reflect on different health literacy skills that we all need. And I want to give you some examples of these skills. So first of all, one skill that we all need is to locate resources that we need in order to take care of our health. For example, say you have a sudden illness or a mental health crisis. You will need to locate resources to take care of that. You might need to access your insurance plan and figure out what's covered and how it's covered. You might need to figure out what kind of doctor you need to outreach to. You also need to be able to evaluate information for credibility. And so we're given all kinds of health information, and we've talked about health misinformation, how chronic it is and how easy it is to fall for it. And so this is a skill that we all need to develop, our ability to evaluate information, understand that information, and know who to trust and where to turn. We need to understand health terminology at times. So for example, say you are newly diagnosed with celiac disease. This means that you now need to avoid gluten in your diet. Well, you'll need to understand what gluten is and where to find it, including where it might be hiding in food ingredients. So there's a batch of health terminology you would be learning in order to manage that condition. Another skill is analyzing the relative risks versus the benefits of a particular health decision. On the right, I have a very unfortunate situation that happened, and this does happen once in a while, where a young child died because the parents put the child on an overly restrictive diet. In this case, it was a vegan diet. I just noticed that the headline misspells Italian. Sorry about that. But this was a real headline, and this was over in Italy. This is an unfortunate real-life scenario where these parents, who I assume were very well-meaning, wanting the best for their child, they underestimated the risk of this restrictive diet. They didn't think that the diet would be risky, and they overestimated the benefit for their child of being put on this restrictive diet. Another skill that we all need to learn at some point is appropriately following medication guidance as well as calculating dosages. And so sometimes we are put on medications and we have to take them at a certain time. This gets more complicated if you've got multiple medicines, to remember to take them appropriately, and also remembering that you did take them. So sometimes you have to have a system in place helping you with medication. We need to be able to calculate dosages sometimes as well. If you have a child and you're giving them cold medicine, very frequently you have to look at the directions and calculate the appropriate dose based on that child's age and sometimes weight. On the left, I have a picture of caffeine powder, and this is because this was used in a real-life situation where a man over in the UK was using this product in order to increase his energy for his workouts. There is good evidence that caffeine used in the appropriate way can help us to have a more effective workout, and that's why he was using this caffeine powder. Unfortunately, the man miscalculated the dosage, and so he didn't follow the dosing information on the package, and he ended up giving himself a fatal dose of caffeine because he did not calculate the dosage appropriately. We need to be able to communicate with our providers. And so sometimes this might mean knowing what symptoms to bring up. Maybe we've got some fuzzy symptoms, or we think that the stomach ache that we're experiencing has nothing to do with the health concern that we're talking about, and that might not be true. Sometimes healthcare providers can be intimidating, and this can shut down communication, but this can interfere with our health. And so being able to speak up, even when it's a little bit scary, is part of the health literacy skills. Knowing how to fill out the forms that they give us to be filled out, all of these things are involved in communicating appropriately with our providers. And then finally, we need to be able to make decisions that are best for our own health and our own life. For example, if you are diagnosed with something like breast cancer, you would be given different options on what you want to do next. And so it's possible that you might be recommended to receive radiation therapy, or perhaps your healthcare provider also is considering chemotherapy or maybe even surgical intervention. But ultimately, the decision is up to you, the patient, and in order to make the right decision, you need those health literacy skills to go back to weighing the risks and the benefits of each. There are a number of reasons that somebody could be experiencing lower health literacy, and I think it's important to note that all of us at one point in our life or more, we all experience periods where we have lower health literacy. And so basically, lower health literacy is a problem for people who have lower language skills in particular. And so maybe they have lower reading skills or a problem understanding the language. If they don't speak the language that the health is being provided to them, or they're not a native speaker of that language, it can be very difficult. Imagine yourself plopped into a country that speaks a different language that you're not very comfortable speaking, and all of a sudden you have a medical emergency. Imagine how low your literacy skills would be trying to navigate a world of a different language while you're trying to learn about your health. People with learning disabilities, even people that have poor eyesight or poor hearing, depending on what we're trying to deliver to them, it might impact their ability to understand what we're trying to say. And then when we have cognitive decline, we also have lower health literacy. But I want you to think about what gives us cognitive decline. Well, it turns out that a lot of things can contribute to cognitive decline. And so it might just be associated with aging, but think about medications. Maybe you've been on really strong pain medications in the past. And remember that your brain was kind of fuzzy. It's hard to think clearly when we are medicated. Depression also will interfere with a person's ability to think and understand, as mental illness will. And then sleep deprivation also will interfere with your ability to think clearly and to learn and to understand. Someone under extreme stress or extreme grief, it will be experiencing low health literacy. And so most of the people who come to a hospital, they're in a situation where they're probably extremely stressed. They might be under medication, they might have depression. And so we do need to assume when we're working with people in a medical situation that a lot of them will be trying to navigate the healthcare process with a lower health literacy set of skills at that moment.